So today we're going to be talking about statin medications. These are cholesterol-lowering drugs. Two of the brand name statins that most people are familiar with, Lipitor, Zocor. There's also Crestor. So if you're taking a statin, you need to pay close attention. The first element to statins that I want you to understand that may have a countering effect to what you're trying to accomplish, number one, is that statins block a nutrient called coenzyme Q10, CoQ10. Now, CoQ10 deficiencies can cause or increase the risk of heart disease. CoQ10 deficiencies have been linked to numerous diseases, including congestive heart failure and high blood pressure. Again, what's the purpose of taking a statin drug? It's to reduce the risk of the development of heart disease. So if a drug blocks a nutrient, and that nutrient deficiency can increase your risk of heart disease, where are you winning in that regard? Something else I want you to be aware of with statins are the long list of side effects. We'll put those up on the screen for you. According to medical research, statins can cause headaches, dizziness, neuropathy, general malaise, severe fatigue, feelings of being physically weak or muscle weakness. Statins can cause digestive system problems such as constipation and diarrhea. Some research shows that statins can cause farting, not very appealing, right? Muscle pain, sleep problems, and statins can reduce your platelet count. So you trade the use of that medication for the potential of all those possible symptoms, and there have even been lawsuits against statins where people have been hospitalized and put in wheelchairs as a result of muscle and nerve damage caused by statins. Now, I don't say all this to scare you. I just want to inform you. You should be well informed, and your doctor who prescribed a statin, if you're taking one, should have had this conversation with you. And I'd like to end this segment with a couple of studies that I want to put up on the screen. In this first study, and this was published in the Archives of Internal Medicine, and it was a meta-analysis, and it had in total over 65,000 participants in this study. And the conclusion of the study was that there was no benefit to using statin medications in people's risk of dying from cardiovascular disease. Now, there's a caveat to that, and I want to make sure I'm honest and clear with you. There was no benefit to using a statin in a patient who hadn't had a prior heart attack or stroke, but who also had risk factors and was considered a high risk factor for the development of heart disease. In other words, these are patients that hadn't had a previous heart attack or stroke. These patients being put on statins, research meta-analysis showed no benefit of being on the statin long term. And that's important to know, because if you're going to your doctor today and you've not had a heart attack or stroke, even if you have risk factors for heart attack and stroke, what this study is saying is that statins won't provide a greater benefit to you. So if the statin's not providing the benefit, but it's providing the Pharma Harma, right? The laundry list of symptoms, the CoQ10 deficiency, why would you want to take it? Now, there's another study that I want to bring to your attention, and this study was published in British Medical Journal, and it was a systematic review of the research. And what this study found is that in people over the age of 60 who had high levels of LDL, which is what doctors consider to be bad cholesterol, that people 60 years and older with high bad cholesterol actually live longer. The research shows that people with high LDL-C live longer than people with lower LDL-C. So if we have that so if we understand that people with high bad cholesterol live longer, why on earth would we try to lower it? And we would combine that with the information from the other research study, which is people who haven't had a stroke or a heart attack don't receive benefit by being on a statin, even if they're in a high-risk category, being overweight, being a smoker, etc., don't receive a long-term outcome benefit in terms of overall mortality. In other words, their risk of dying from a heart attack or stroke is not any higher, even being on a statin, if they haven't had a prior heart attack or stroke. So you make your own judgment call, but now you're armed with some facts that you can go and have a conversation with your doctor about.